18 months, there has been a lot of construction and activity going on at the 11 acres across the street from Lakeland Regional Cancer Center on Lakeland Hills Boulevard. If you've been wondering what was built there, you can get an answer today on Polk Place. Joining us today is Don Evans, the Executive Director at Good Shepherd Hospice. How are you doing today, Don?
I'm fine, Tina.
All right, so Don, what is that building at 3450 Lakeland Hills Boulevard?
Well, that is our new inpatient hospice house for Good Shepherd Hospice. It's a 16-bed facility, state-of-the-art, and it is designed to provide pain and symptom management for our patients who are in hospice.
Awesome. We've had a few programs here about hospice care, but it's probably a good thing to remind people what it's all about.
Well, hospice is really a philosophy of care. It provides care for a patient who is in their last 6 months of life. You know, it's been described to me best by someone else at Good Shepherd one time. I heard them say this. They talked about a remote control, and if your house is like my house, after dinner at night and we're watching television, the person who grabs that remote first is often the one who gets to choose what channel we're going to watch or what show we're going to watch that night. Well, with hospice, it's like giving you your healthcare remote control to the patient, and probably for the first time in their life, they get to control what's going to be happening to them over the later stages of their life using hospice.
Oh, so what type of services do they provide?
Well, we provide all types of services for the care of their illness, and we do this in a team approach. The team has physicians, nurses, social workers, chaplains. It can have therapists like respiratory therapists and pharmacists included in it. All these people come together and to provide the best possible care for our hospice patients. So we provide all the medical needs for their terminal illness, but at the same time we provide social and emotional support for not only the patient but for their family members as well. And then through our chaplains, we also then provide spiritual care for the patient and their families.
That's amazing. There can be some confusion about where a patient receives hospice care. Can you clear that up?
Sure, you can receive hospice care any place where you live. The vast majority of our patients receive that care in their private residence. However, if you're in a skilled nursing facility, an assisted living facility, we provide care for our hospice patients in those. Wherever you call home, that's where we'll go. At Good Shepherd, we have provided hospice care to patients in prisons in the past. So it's where you call home, that's where we will go to you to provide the care.
Okay, so you guys come to us. Can you explain why Good Shepherd Hospice built the new hospice house?
Sure. Actually, in a way, it supports our values of patients and families come first. But we believe very strongly that we need to provide a full level of care or a full continuum of care for our hospice patients. We have found through our experience and some studies that about 40% of our patients will need some sort of what we call general inpatient care during their stay with hospice. And while that can be done in different settings, it can be done in a hospital, we believe it's best done in a hospice house. So this is certainly a commitment to us, to our community, to provide that level of care in the best facility possible for our patients.
Okay, so it's like a home-like setting. Can you explain that?
Sure. We have a 30,000 square foot facility in Lakeland, and it has been designed to provide both a peaceful and, as you said, home-like setting for our patients and their family members. As I mentioned earlier, we have 16 rooms. These are all private rooms, and attached to these private rooms is both a private bathroom, but also a lanai that opens to the outside where either our patients or the family members can go.
Very nice.
We have such services, you know, our furniture is as home-like as we can make it. We hide as much of the medical equipment behind cabinets as we possibly can to give it that home-like setting. We have Wi-Fi. We have Skype for our patients, cable TV, DVDs, pretty much whatever the patient and their family wants. We always have a sofa in each of the rooms that folds out into a bed. We encourage family members or loved ones to stay with our patients. In the house itself, not only do we have the rooms, but we have a separate dining area for patients' families. We have a separate laundry for the family members because often they're flying in from out of state to see their loved one for the last time and may need to do some laundry. It's there for them. We also have a common living room type area that they can use as well.
Oh, that sounds like an amazing environment. So who staffs the hospice house?
Well, we staff it. We staff it with physicians, nurses, and aides, and social workers and chaplains. It is staffed 24 hours a day, 7 days a week. There are always registered nurses on site. There is a physician rounding at the house on a daily basis.
Okay, so why would a patient go to a hospice house?
Primarily, our patients go to the hospice house for symptom management, whether that symptom is uncontrollable pain or it can be shortness of breath. It's something that has been unable to be controlled in their home. And we have found that the vast majority of our patients want to stay at home, and we make every effort to keep them there. But what we've also found is if we can't control their symptoms in the house, they don't want to go back to the hospital, and they don't want to go back to a setting where they may be getting unwanted testing done, procedures, that sort of thing. So we can bring them into the hospice house. We are able to care for the most critically ill hospice patients in the house, get their symptoms back under control, and get them back home again to their loved ones.
Okay, so how has the community responded to the new hospice house?
We have had an exceptional response from the community. We've been doing hard hat tours throughout the construction of the project. I think we typically average 30, 40 people each time we gave a tour. We have a community advisory board for the hospice house who has helped us and assisted us through the construction of the house and continue to do so now that it's operational. I know I've talked to a number of our patients and their families, and they are just so thrilled that the facility is there for their use when they needed it.
That is amazing. So the community still can tour the house?
Oh, absolutely. We're happy to give tours to anyone. If you want to have a tour, probably the easiest way to do that is call our number. It's 863-297-1880, and we'll be happy to tour not only the Lakeland Hospice House, but we also have a house in Auburndale, the Forsyth Hospice House, and we give tours all the time of both facilities.
Okay, and where is that facility located?
That is in Auburndale, right by the fire station in Auburndale.
Okay, thank you. Don, I'd like to thank you for joining us today. Our guest on Polk Place has been Don Evans, the Executive Director at the Good Shepherd Hospice. For more information on the new Lakeland Hospice House or Good Shepherd Hospice Care, you can go to www.chaptershealth.org/hospice or call 863-297-1880.